Medicare, working and turning 65, what to know if you're still employed. Welcome to Empowering Your Future, a Banker's Life podcast.
Welcome back to Empowering Your Future, a Banker's Life podcast. I'm your host, Jonathan Lawson, insurance professional and dedicated Colonial Penn and CNO employee. Today, we're diving into a topic that affects more and more Americans every year as people are living and working longer. What to know about Medicare, working and turning 65 if you're still employed. Now, first, this is just a reminder that Banker's Life and its agents are not connected with or endorsed by U.S. government or federal Medicare programs. So, if you or your spouse are still employed when you hit that milestone birthday of 65, Medicare works a little differently. There are choices to make, and the answers depend on your unique situation. So let's break it all down and help you make the best decision for your health and your wallet. With me today is Carmella Rose from Banker's Life. Carmella, can you give a quick overview of your role at Banker's Life?
Sure. So I am a financial professional, and I've been with Banker's Life since 2022 and licensed since 2016. I love working with Banker's Life because I'm able to support and educate a lot of people that are going through retirement and working through some of these confusing areas, just like Medicare.
That's awesome, and confusing they are. So thanks for that. Now, I know you had experience working with clients on this topic. Can you share some of the most common concerns or questions people have as they turn 65 but are still working?
Sure, I'm happy to discuss that with you. So it truly is one of the biggest questions that I get from people is, if I'm turning 65, do I need to sign up for Medicare, or can I stick with my employer coverage? And so the answer isn't normally really straightforward, okay? It does depend on some key factors like the size of your employer and how many employees, the type of coverage you have, and your personal needs, of course. So why don't we start with the employer? This is a big one because it falls into two buckets. You have an employer with more than 20 employees or fewer than 20 employees. So first, let's talk about the employers that have many, over 20 employees. Okay, so you usually can delay enrolling in your Medicare Part B. This is the medical insurance portion of Original Medicare, which is going to cover your outpatient care, doctor's appointments, preventative care, and durable medical equipment. And this portion does come with a premium, which is determined by your income. Now, most people in this situation choose to enroll in Medicare Part A, which is your hospital insurance for room and board only. This will cover you if you are an inpatient, whether it's at the hospital, skilled nursing facility, hospice, or sometimes some home care. So if you've worked for 10 years in this country and paid all those lovely taxes, specifically the Federal Insurance Contribution Act taxes, you're able to get this Part A for free. Now, Part A also can act as a secondary, helping pay for those things that your employer's coverage might not pay for. Now, let's talk about if you have fewer than 20 employees at your place of work. The rules change. So in most cases, you'll have to enroll in Medicare A and B, which is the complete Original Medicare program. And that is what we refer to as Original Medicare when you turn 65. And that's because your Medicare becomes your primary payer, and the employer coverage then becomes secondary to that.
Carmella, this is valuable information and clears up much of the confusion people might have in this situation. So, what factors should people consider before making a decision?
That's a good one. So, there's a few. Okay, so I'll kind of go over the big ones that I feel are most important. Number one, cost. You want to look at your employer's plan premium, what is being deducted from your paycheck and how often, the co-pays on your plans, what the out-of-pockets and deductibles are, and then look at what Medicare would cover and what those out-of-pockets are. Don't forget to incorporate your prescription drug plans as well, because that is a factor. Number two, coverage. Look at what your plan covers. Does your employer plan offer better benefits for your needs? Or maybe Medicare is going to fill some of those gaps that your employer coverage leaves you with. Number 3, a health savings account. Now, this is pretty typical with some larger employers, where if you are contributing to a health savings account, or what we call a HSA, you have to be sure that if you become eligible for Medicare and you enroll in Medicare, you no longer are able to contribute to your HSA. If you do continue to contribute and you are enrolled in even just Part A alone, or both A and B, you could be subject to a 6% excise tax. So you want to make sure that you understand how that works, your HSA with Medicare. And then a big one, number 4, is late enrollment penalties. You have to be careful, because if you do decide to delay your Part B and you don't meet certain criteria, you could be facing a 10% penalty for each full 12-month period that you go uninsured with no Medicare and no credible coverage. The penalty is actually added on to your monthly premium for Part B, as long as you have it, which most likely will be your lifetime. Also, for the Part D drug plan, there is a 1% penalty of the national base beneficiary premium for each month that you were eligible and you didn't enroll. These penalties will stick with you for life, so it is so important to make sure that you understand what those enrollment windows look like. Number 5, coordination of benefits. This is important because you have to understand how your employment coverage works with Medicare and how they work together. Sometimes one plan pays first and the other pays second. But in another situation, maybe your employer coverage pays first, like when you have over 20 employees, and Medicare falls second. So you want to make sure that you know how it works so you can save money and headaches.
Wow, Carmella, that's a lot. And it makes a lot of sense. So when someone has figured all this out, what's their next step?
Good question. This is important. So generally, we recommend 3 steps to our clients. Step number 1, talk to your employer's benefit department. Find somebody in HR that you can ask to be sure that your coverage is within those guidelines, so that way you're not facing penalties later. Some employers actually will require you to enroll in Medicare at 65, while some of them don't. So be sure you know which one you fall under. Number 2, contact Medicare, Social Security, or even better yet, call your Bankers Life agent, as we can help answer some of these questions that you might have. Getting the facts about your eligibility, enrollment options is so important. A good resource that you can revert to is www.medicare.gov to answer some of your questions. And then last but not least, review the details. Take the time to make sure you truly understand what your responsibility is on these plans. Compare those costs and coverages and benefits, and make sure you understand those deadlines and penalties, because we don't want to be faced with those and be in a situation where possibly it could be too late.
Okay, Carmella. So let's recap and keep me honest here.
Got it.
If you have an employer coverage when you turn 65, you may be able to delay enrolling in Medicare, but you need to know the rules. The size of your employer matters. 20 or more employees gives you more flexibility. Fewer than 20 means you'll likely need to enroll in Medicare right away. Mm-hmm. Compare cost and coverage, and don't forget about HSAs and potential penalties. Mm-hmm. And lastly, talk to your benefits department and Medicare to make an informed decision. Does that sound right?
You did it. Good job. So yes, turning 65 is a big milestone. So making the right choice about your healthcare coverage can help you enjoy this new chapter with peace of mind. Being able to put your head down at night and sleep well, knowing that you made an educated decision and you were aware of all of the factors. I really appreciate you having me today, Jonathan. Thanks again.
Thanks for bringing your expertise to the table today, Carmella. You've given us a lot of valuable information to help guide people facing these decisions. I know I've learned a lot, and I know our audience did too. Please keep watching this space, as we're excited to cover more topics in the future episodes. In the meantime, check out our Bankers Life blog at www.bankerslife.com medcarerules.com/insights for more resources. Thank you for joining us today. And until next time, be empowered.